Recovering from shoulder injuries. What to expect from rehab.
Shoulder pain can be frustrating. It limits your reach, sleep, and even simple tasks like dressing. But with the right rehab, recovery is possible. Hi, I'm Shinraj, Rutherford Physiotherapy in Edmonton. Common shoulder injuries includes rotator cuff tear, frozen shoulder, otherwise is called as an adhesive capsulitis, tendonitis, post-surgical situations. Each condition requires a specific treatment approach. At Rutherford Physiotherapy, our approach includes manual therapy to increase joint movement, targeted exercise to restore function and strength. The goal is not just healing, but regaining full use of your arm.
FAQs. How long does shoulder rehab take?
It depends on the condition. Tendonitis may improve in weeks. Frozen shoulder can take a few months, but early and a consistent therapy speeds up the results.
Can I avoid surgery with rehab?
In many cases, yes, physiotherapy is effective in preventing or delaying surgery, especially for an impingement, minor to moderate amount of tear.
Will the pain come back?
If the cause is corrected, say for example poor posture, weak muscle, the reoccurrence is unlikely. Don't let the shoulder pain drag on. Let's work together to restore your movement and quality of life.